So I heard about the Health Scholar program actually by word of mouth. I was kind of looking for another way to fulfill clinical experiences, continue to work at the hospital, and then through one of my classmates at UCLA, they talked about the COPE Health Scholars program, and right off the bat when I applied for the program, they took us through an intensive 30-hour training process where we went through workshops to actually do basic patient care, such as ambulation and feeding and transferring from bed to gurney. And these are really, really new skills that I haven't been able to work with before, and I think that that in itself made me feel like I belong in that hospital care setting, that I was part of the patient care team, that I felt integrated with all the healthcare workers. And I think that's what makes this program so special to me in comparison to all the other healthcare programs that I've been a part of. So many students, when they join this program, they set themselves up with the expectation that they're going to see a lot of cool procedures in the ICU or the ER or surgeries. And aside from those, I have indeed seen a lot of those cool procedures that a lot of people anticipate when they join this program. I really think what makes this program the most meaningful for me is the human interaction that I have with patients, and really being able to get to learn a little bit more about the patient population that I want to serve later on in the future. Most recently, right now, I'm currently shifting in the pediatrics department, and one particular patient of mine, right when I got to the wing, the nurses asked me to help keep this one 6-year-old patient company. And when I walked in, this patient was so timid, he was so shy, and not many words came out of his mouth. And for me to keep this patient company, even though I try to ask him questions, try to get to know him better through words, he was just so shy, but his face, his body language, his expressions kind of told the entire story about where he came from. You know, as a 6-year-old, the last thing you want to be doing is sitting in a hospital with a chronic condition. And so I can kind of see that despair in his face. I can kind of see the sadness of not being able to join his friends and be a kid and go to school. So that whole day was really spent playing Wii games with him, coloring picture books, and playing musical instruments together, petting therapy dogs. And for the first time, I could see his face light up in a way that it didn't seem to light up in a previous point in his past. And he felt like a kid once more. Like I said, this is what really draws me to go to medicine. It's just people feel like a human once more once you learn to work with them in ways that they will heal their lives. So that is probably the most meaningful experience for me working in the Health Scholar program.